Hello everyone. Today we will discuss about the genomic imprinting. This is a disorder follow the non-Mendelian inheritance or exception of classical Mendelian inheritance. So what is genetic imprinting? This is an epigenetic phenomena where the expression of certain gene is determined by the parent of origin. So the parent of origin is decide the expression of certain gene. Normally we inherit two copies of each autosomal gene on homologous maternal and paternal chromosome, and the important functional differences occur between maternal and paternal allele because of the epigenetic process. The epigenetic process involves DNA methylation in cytosine and guanine nucleotide and histone H4 deacetylation and methylation. They are responsible for the transcription silencing, and this process is known as genomic imprinting. This is the exception of classical Mendelian inheritance. They do not follow the classical Mendelian inheritance. And imprinting particularly occur before fertilization in ova and sperm and transmit to the all somatic cell through the mitosis in a zygote and later on the other stages of embryo. The molecular basis of genomic imprinting disorder, first is deletion. Deletion is responsible for most of the cases. Loss of critical imprinted gene region, and other mechanism is uniparental disomy and imprinting defects. In uniparental disomy, inheritance of both the copies of a chromosome were from a single parent, either from the maternal side or paternal side. And third one is imprinting defects in imprinting coding regions. So these are the three molecular bases: deletion, uniparental disomy, and imprinting defects in the various genomic imprinting disorders. Now we will discuss about the various examples of common genomic imprinting disorders. First is Prader-Willi syndrome and the other is Angelman syndrome. We will compare them. So in Prader-Willi syndrome, there is loss of paternal genes in the locus of 15q11 to q13, and in Angelman syndrome, loss of the same gene or same locus of the maternal gene. The gene involved in Angelman syndrome is UBE3A gene, and in Prader-Willi syndrome there is a group of or a family of genes involved. In Prader-Willi syndrome, paternal deletion is there, resulting into the maternal uniparental disomy of the chromosome 15, and in Angelman syndrome there is maternal deletion and paternal uniparental disomy of the chromosome 15. In the clinical features, Prader-Willi presented as neonatal hypotonia, feeding difficulties, hyperphagia, obesity, mild to moderate intellectual disability, hypogonadism, short stature, temper and tantrums, and obsessive compulsive traits. These are the features of Prader-Willi syndrome. And in patient with the Angelman syndrome, they present with feeding difficulties, developmental delays, severe intellectual disabilities. ataxia, seizure, and their demeanor is happy puppet demeanor. Basically, they are ataxic and frequently smiling and laughter. Microcephaly is also noted in the case of Angelman syndrome. So there is a mnemonic in Prader-Willi syndrome. P stands for paternal deletion, and Angelman syndrome, M stands for maternal deletion. Another disorder of genomic imprinting is Beckwith-Wiedemann syndrome. This occurs due to the imprinting in the genes of chromosome 11p15.5. This is an overgrowth disorder. Mechanism involved in Beckwith-Wiedemann syndrome is, the most common mechanism is loss of methylation at imprinting coding region 2. This is the most common cause. Other cause is gain of methylation at imprinting coding region 1, paternal uniparental disomy at 11p15, and CDKN1C mutation. Clinical features of these syndromes are macrosomia, large body size, macroglossia, large tongue, omphalocele, and hemihyperplasia. Patients with the Beckwith-Wiedemann syndrome are particularly on high risk of the development of embryonal tumor like Wilms tumor. One more example of this genomic imprinting disorder is Silver-Russell syndrome. This is because of the hypomethylation of the imprinting control region 1 on chromosome 11p15.5. This is opposite of the Beckwith-Wiedemann syndrome. This hypomethylation will result into the low expression of paternally expressed IGF2 gene and result into the under expression of the growth promoting region, and there is decreased growth or undergrowth. Maternal uniparental disomy of chromosome 7 is there in Silver-Russell syndrome. Clinical features of this disorder is intrauterine growth restriction, pre and postnatal growth failure, small and triangular face, and body asymmetry. So this is a brief about genomic imprinting and the various disorders associated with the genomic imprinting. Thank you for your time.